normal saline, and I have my hydrogen peroxide. So I'm going to remove everything from the table that I don't need because you really won't have that much room to work. And the other thing that I would put across the patient's chest if I had it would be a towel or a chuck. So we'll just pretend that this is a towel, because what happens is when you start messing around this trach and you start if you're just suctioning the trach or you're doing trach care, anytime that you move this trach, it is going to irritate the trachea, and it's going to make the patient have that spasm of the trachea, and they're going to want to cough. So it's not unusual that sometimes you can suction the patient, do trach care, but by the time all that stimulation has taken place, then you have to do suctioning again at the end of the trach cleaning, because of that. So leave that there. Okay. And I'm going to go ahead and open my kit. So it's got the little label right here to open. Oh, and it does have gloves, I think. Yeah, we got gloves. Okay. So I'm going to leave my kit open here. And the very first thing that you want to do is think through your procedure. So open your containers, because if you don't, you might get caught at the end. So you don't have to take the caps off, but just loosen them up.
That cap came pre-loosened.
Okay, and now I've got to get the gloves out of here. And then I'm going to go ahead and put my gloves on. Remember, this is the outer rim of the tray, so I can adjust the tray and move it anywhere I want, okay? But where can I not touch that tray?
Inside.
On the inside. Okay, so here's what I'm going to do. I'm going to get my first glove on. Grip under here. See how your gloves come? So you just do the best you can.
Uh-oh.
Don't let it fall back. Don't let it get stuck together. And then get your first glove on. I know what you got.
Yeah,
You
let
gotta-
the instructors go right ahead.
We struggle.
You gotta work with what you got,
You
right?
gotta work with what you got. Okay, so there, glove is on. Just be careful, you just gotta be careful with it. And this is still sterile, and I'm not ready to pick that up yet. So what I need to do now, though, is come over here, and I can adjust my tray again because I am sterile to sterile, right? Sterile glove to here. So what I need to do now is I need to get everything out of here and onto the table. So here's my little thing, my drape, and remember the shiny side goes down. So let's see, and I don't need it opened all the way. I mean, this is plenty of room for me. So there. And then I'm going to go ahead and take my supplies out here. Here's my sterile dressing. Now, can I set it like there? No. Can I even set it in the 1-inch margin? No. So be careful when you set it down to make sure that you're right in the center of your tray. Here's my tray ties. I'm going to put those there. And then here's the gauze dressings, which they're kind of always stingy with these things. So there's one, there's two. Is it opened up? And I think you got 4. Yeah. Okay. So there I've got 4 little gauze dressings, and then here's my little pipe brush that we're going to scrub the trach with once it's out. So I'm going to leave it right there. So now you see that this has 3 compartments in here. And so now we have to designate what we're going to put in each compartment. So what I'm going to do first, the largest compartment I'm going to mix with my pure hydrogen peroxide. I guess this will be my rinse here. So that'll be my clean. So I'm just going to leave those in place so I'll kind of know what I've got going here. And then I don't want to cross over my sterile field because that breaks one of our sterile technique rules too, right? So what I'm going to do now, because of my unsterile hand here, I'm going to come around this way and take the lid off.
Can we take the lid off before we say this?
Well, can, but you know, you just don't want to. Now, if you get stuck and you can't get it off, there's a trick. Use your underarm. Those pits come in handy for something. Oh, and I didn't work. But I didn't realize that this had a. I thought this was open. But
Those come in handy too, though.
this no. You have to do this independently.
Must be the accent.
But yes, well here.
That's the PC term too.
Because I didn't realize there was a little thingy on here. Okay.
Some women could do that.
Do what?
Right down
But
the
the same thing, like hand me that lane right behind you, that bottle of stir water. If this happens to you and you forget to undo your caps, just remember, all is not lost. Just hold it on here and undo it, okay? Where there's a will, there's a way. All right, so I've got my, this is going to be my, but there is nobody. There's nobody, Brenda, it's just you. Can I set these caps up or down? They have to be up. Okay, so the first thing I'm going to do is I'm going to go ahead and fill up my hydrogen peroxide, because this is where the trach is going to go in to be clean, because these trachs, when you see them in real life, a lot of times they're going to be gunky, yellow, thick, viscous, sticky, hard to get off mucus. That's what you're going to see. And then my half and half I'm going to mix over here. And then my, this is my half and half. I'm going to make half hydrogen peroxide, half saline. And then we have to rinse the trach too, so that's going to be all saline here. Okay? And don't just pour a little bit, like 10 cc's. Don't be stingy with your liquids. These are fairly cheap liquids, because you really do need to be able to submerge. Now, have I turned my back on the sterile field? Okay. So now I've got to come back over here, and just to remind you that this one hand is sterile, you can even keep it fisted at all times. So do you see what happened is I've set up the sterile field using one hand pretty much. So now I've got to get over here and get my other glove on. Oh, and did I tell you guys that our patient has MRSA of the lungs? Okay.
Dripping chlamydia or something like that.
Really? Up the tray?
Yeah, you could have chlamydia pneumonia too. Okay, now my tray is still not exactly where I want it to be. I really need it to be over here on this end. So I'm going to use my feet and turn everything around, and it should be closer to me so I don't have to go very far. And remember, I'm still sterile, so I can move this over here. And I'm still sterile, so I can move this even closer to. Okay? Now, I think I'm looking at everything before I proceed, and before I make this hand unsterile, I'm just kind of resurveying, and I'm happy with everything. So I'm going to go ahead and say, Mr. Jones, we're ready to start. I'm going to take your trach out. So kind of stabilize it and pull. And you want to pull down downward toward the chest, because that's how it goes in naturally. So I have it here, and I'm dropping it in what solution?
Peroxide.
Hydrogen peroxide. Not the 50%, the straight, 100%. And then at the same time, I'm going to go ahead and remove this nasty 4x4. And that's my garbage. Okay, so now I'm ready to get my sterile brush, and with my non-dominant hand, I'm picking it up just by the little, what do you call that? Cuff, actually. Yep. And I'm going to scrub the outer, and then I'm going to take my brush and I'm going to go inside about halfway. Then you have to kind of come out, and you have to kind of go this way. Kind of wiggle the brush in there, because you really want to make sure you get all of that corroded stuff off of there. Now my brush is done, and do I need to do anything with it? Am I coming back to this part of the tray? No. So I'm just going to drop it right there. And now what do I have to do with this?
Rinse it with the normal saline.
Plain normal saline. Remember, we are washing, we're rinsing, And then I'm gonna show you how we kind of pat dry here.
That's actually good.
So, and I'm making sure that it really gets saturated because has anybody ever used hydrogen peroxide?
Yes,
It's very caustic, so you can imagine putting it on a raw trach, that it bubbles up and it would be very caustic. So we want to make sure too that there's no large molecules of water, because even one drop of water down his airway will cause him to aspirate. So make sure that we tap, tap, tap. Okay, and now we've got a good grip. You can switch hands to hold this plate steady, and we're going to put the trach back in.
And that doesn't get dried off?
Nope, we tapped it. The water actually lubricates the trach to make it easier to go down. And I heard it snap into place. And that's really important. Did y'all hear that? Now, once the trach is down, the sterile part is over. We're done. You know, now we have to clean it though. So now comes the clean part. But once the trach is in, we're good. Okay, so now I'm going to take my swab here, and here's the thing, guys, too. When you're cleaning the trach, and some people have a very short neck, so it's not easy. I don't want you to put this on the outer skin. You need to get up here where the actual opening is, the wound opening, because that's what we're cleaning. We're cleaning down here. And you're going to go a half moon, one direction, distal to proximal. So we're starting away, half moon, we're coming here, and then we're going to drop, and you can even drop it back in here because that part is dirty anyway. Then I'm going to pick up my other swab, and I'm going to come up here, and I'm going right around the meatus of the trach, the opening of the trach. So everybody following so far? And I'm dropping. So now we've washed it, and that was with our 50-50, okay, the hydrogen peroxide. We washed it. So now I'm going to go into the same normal saline, the same saline that I rinsed the trach in. So even though it probably looks really yucky, it is still the patient's own flora. And I'm wetting one of my gauzes here, and I'm going to take my gauze, and now I'm going to come under the cuff here, and I'm rinsing, because I'm rinsing off that 50% hydrogen peroxide, because it can't stay on the skin. And then I flipped it over on the other side, and I'm coming here, and I'm doing the same thing, one swipe, okay? So that's done, and now I've washed it, I've rinsed it, so now what comes next? You gotta dry it. Y'all done dishes before. So same thing, we're gonna just come under here, one direction, one swipe, and we actually have an extra, so we could use this one, but if you don't, you just flip it around. Same thing here, one direction, one swipe. And in reality, these little sticks don't do a whole lot for you. You really probably will need some extra 4x4s. So we got that done. So we've washed it, rinsed it, put the trach back in, the skin around the opening. We've washed it with 50% peroxide and normal saline. We've rinsed it with normal saline, and we've dried it. And so now I'm ready to put the gauze under here. And if you have a guy with a short neck, you know, if you have hemostats, that would help. I didn't think about bringing my hemostats in here today.
I have a question.
Okay.
Would it be uncommon to see drainage from that area after you're looking at that site?
Oh, yeah, yeah.
So what if it's just
I mean,
like
there's usually a lot of drainage. I mean, that's why.
after you're taking it from, after you take the gauze out, it will still be drainage coming from it? Oh,
Could
okay.
be, yeah. It depends. I mean, sometimes you get a trach patient and they're in with pneumonia, and they produce a lot of sputum just because of the infection, the respiratory infection. So what questions do you have so far?
I'm wondering if they do have a really thick neck. Are you able to
Well, to a
tilt
degree,
the head back?
but you
or-
got to remember that every time that you wiggle this trach, it's going to irritate the inner trach of the patient.
want them to put their
Right,
head back?
and it's even traumatic doing the cleaning, but you have to clean it or else it really will
You
get
can't
infected.
get to it, you can't see it, because, I mean, I know when I did it, it was really, really hard, and that wasn't
It
even a
is.
big guy, it was a skinny guy.
Right, and remember, guys, this is the mannequin. He's not gonna, be turning blue on you or anything. So you know, you're right. I mean, every person's gonna be a little bit different. Some people are gonna be more challenging than others, you know. What you can do, you can maybe let their head down just a little bit if they can tolerate it. Most people that have airway disease, they can't tolerate being down very flat. So you just have to kind of work around the best you can, you know.
After we, say there's some, dried secretions around that, we can
Right.
use a 4x4 that's
Absolutely.
soaked
Get
in
it
what,
clean.
normal saline?
Normal
or the
saline.
50/50?
Yeah, normal saline usually. You don't want to use too much peroxide on the
Okay.
skin
'Cause it-
because, you know, again, it can bubble and everything. So if you can get it off with saline, that's always the better.
Okay.
And I'll tell you, the 50/50 is a little bit debatable depending on what research that you read. And as evidence-based practice comes down the pipe, we're probably in the future will not see peroxide used only to wash the trach to get all the secretions loosened up. It's great for that, but as far as doing the washing of the meatus around there, they probably will be getting rid of that. But right now, it hasn't caught up with the textbook, so we're just teaching you the way your textbook says. So this part is a little bit tricky too. If you're lucky, you'll work in a facility that actually has the commercial tube holders. But of course, they're more expensive than regular little twill tape. So that's why you have to learn how to do both. So his head's to the side. You're going to push the old ties up, okay? And you're going to go ahead and insert the